I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in Scottsdale, Arizona. I want to talk about environmental contributors to cancer, and in some cases, environmental causes of cancer, what also is called carcinogenesis, the genesis of cancer. When we look at this concept of environment, I think we have to first define what that actually means, and then we'll dive into some of the details of that. The current environment around the world really has, I think, adulterated the concept of what environment means. Most look at the environment as what's outside. But understand what the word environment means actually goes back to an old French term, environing, back to late 14th century, where it literally meant to surround, encircle, and encompass. So when you look at what the word environment should mean in the context of what we're talking about here, which is contribution to the process of cancer, whether it be the cause or the spread or whatever, we have to understand that really what it is the surroundings and the conditions in which biochemistry, physiology, and life exists and functions. So what that means is it's not just an outside influence. That is the environment. So when people think of environment, they think of, outside. They think of smog. They think of all those things there. Now, the Environmental Working Group has appropriately talked about how one of the most toxic environments is the house. So there's the outside. We exist in it. Then our house is where we spend actually most of our time. So that's another concept or context in which conditions and environment exist, of which we live. But then if we want to talk about environment, if we want to talk about how that contributes to the potential of cancer, what better environment of that than is this body? This gets missed on almost everybody. Everybody thinks about outside, but they forget about inside. And environment doesn't just imply what we get influenced by. What we do with this allows us to influence our reaction to that. So when you look at it from the outside to the home, which the Environmental Working Group has called the home the most toxic environment, I would tell you this, our bodies, hopefully not mine, and hopefully not yours, our body is the most potentially toxic environment. The condition and the surroundings in which biochemistry, physiology, and life exist. Now, just as it is the opportunity for, the contribution to cancer, it's also the opportunity to heal. That's the body. So now that I think we have a better understanding of the context of what environment means, I think we can dive into some of the specifics about how the environment, whether it's outside, whether it's the home, could be the car, whether it's our bodies, how we can look at the causes and also how we can affect change there. Because this is not a passive process. We can be very active in this process. So when we look at this context, we really have to look at broad effects. And then later what we can do in other posts is dive into more specifics and more basically deeper dives into the actual evidence and science, because we want to always lead with the evidence. Okay? This is not conjecture, this is not theory, this is leading with the evidence. So that's what we want to do here. So there's really 5 different mechanisms I want to broadly touch on as it relates to environment. First is lifestyle, and the predominant there is diet. But understand that lifestyle also implies, beyond diet, implies exercise, stress, sleep-wake cycles. Well, now there's a disrupted one, because when you look at it as it relates to cancer, the concept of night shift working, numerous studies have shown that night shift nurses are associated with a significant increased risk of breast cancer. So, that is a lifestyle. It is living and disrupting the circadian rhythm. There are also issues related to lifestyle like exercise, whether you exercise or don't. And so there's many contexts to what is a lifestyle contributor to cancer or to the prospect of healing. But I want to specifically and just briefly focus on diet, because when you look at the way conventional medicine, particularly conventional oncology, looks at it, they will tell you that diet plays no role in the contribution to, nor the potential healing of. Yet evidence tells us something very different. In fact, I've heard this quote so many times from patients, and in context with the following statement is that sugar plays no role in the context of cancer. Then the doctor's sitting there writing something, and the patient says, well, what are you writing? So, well, I'm writing you a prescription, an order for a PET CT scan, which is a scan that is accompanied by giving radioisotope tagged sugar. So saying there's no contribution, then saying I'm going to use that to evaluate how cancer is growing is completely missing the connection of how not just sugar, but the dietary impact of that can affect that. So when you look at this concept, we know that diet affects carcinogenesis, but more also the ability to treat cancer. There was actually a study that looked how diet affects toxicity up to 100-fold associated with chemotherapy. Let me repeat that and clear that up. What you eat, feeding your body through your mouth, also understand through the skin, but feeding your body through your mouth is a potential means to communicate well with your genetic code and your body's function, or it's the ability to disrupt it. But what you put in your mouth is going to increase potentially the toxic effects of chemotherapy by up to 100-fold. That's what research shows. So when you look at it, it's not just the contribution to the process of cancer, because we know that what you eat can actually disrupt the gut bacteria and promote systemic inflammation through what's called LPS, which is a contributor to metabolic endotoxemia. We know that this process can actually promote chronic inflammation, and that is the foundation in which cancer exists. Now, we can take deep dives in that, and we'll want to, but let's leave it there. So not just in causation, that inflammatory bed in which cancer and chronic disease exists, but it can actually increase toxicity of chemotherapy. But likewise, studies have shown that we can improve efficacy of treatment with chemotherapy by what you eat. But it's all through affecting the gut bacteria, but it's affecting it through diet. We can even impact estrogen metabolism through what you eat. That old saying, Mom said, eat your broccoli, clean your plate. Well, little did Mom know that that was actually influencing epigenetics through microRNA, but what it was doing is changing estrogen metabolism, in part. So this is just some basic concepts of how a lifestyle choice, like what we eat, power in our hands to make a choice to impact not just the causation of cancer, but also the effects of treatment, of general treatment, but also the effects of toxicity, the side effects, the adverse events, which are the biggest issues that we see in all of the cancer treatments in conventional medicine today. So I kind of touched on this just a little bit in diet, but gut. You really have to look at the gut, which is number 2 in this 5-part discussion, and understand that really the question is the gut affecting the rest of the body, or is the rest of the body affecting the gut? Because really, when you look at the gut, just in terms of the context of the gut microflora, the microbiome, the bacteria that exists there, they are a dynamic environment of bacteria, many of which are healthy and needed, what's called commensal. There's other there that are called opportunistic bacteria, which means given the right situation, the right balance, they can create problems. And then there's pathogenic bacteria. But what we're talking about here is just simply, what's the normal healthy balance there? Because a slight deviation one way or another in these healthy bacteria can in and of itself promote a condition called dysbiosis. This just means imbalanced bacteria, no pathogens, no opportunistic issues involved here. It's just imbalance of normal gut bacteria. That in and of itself can generate a breakdown in that gut lining in what's called the tight junctions. And through that is where you get that leaky gut that everybody talks about. And understand leaky gut, once that happens, that it doesn't always exist. A person can go back and forth with that condition. So I'll see patients that come in, they say, oh, I have leaky gut. Well, when were you diagnosed? Well, I wasn't diagnosed, I was told that. When? 20 years ago. I said, well, you may not be now. There are studies that help us to evaluate that better, but understand that this context exists by and exists within the realm of that gut and the bacteria. Beyond that, then, the imbalance of the gut can promote through that leaky gut, and leaky means things leak into the systemic circulation, inflammation, particularly what's called lipopolysaccharide, LPS. It comes from gram-negative bacteria. And as this sneaks through that gap through those tight junctions, it actually promotes systemic inflammation. Now, one of the ways it does that is does it through nuclear factor kappa beta, and we can do deeper dives on that. But understand this drives chronic systemic inflammatory production from gut bacteria through the leaky gut, through this LPS, through dysbiosis to promote systemic inflammation. How much so? We know that this contributes to the process of insulin resistance. We know it can cause type 2 diabetes. Get this, we know it can contribute significantly to local tumor recurrence postoperatively, to metastasis, and to resistance of chemotherapy. That is inflammation simply coming from the gut, the bacterial population in the gut. Infection aside, diet aside, now the greatest way to impact the gut bacteria is through what you eat. And don't forget the liquids that we put in our mouth as well. But that impacts and lays the groundwork for chronic and systemic inflammation, or it counters that and promotes healing. The third context of environmental contributors to the process of cancer is hormones. Now, I want to touch on this just a little bit different way. First, I want to talk about the hormones that we produce in our body. And let's do that by talking about toxins versus toxicants. Toxins are defined by Merriam-Webster as basically substances produced within the body through the process of metabolism. So they're endogenously produced. And these are toxic substances to our body. So they're things we produce. Toxicants are outside the body. So there's environment outside toxicants. There's toxins inside environment that are toxic. So we have to understand both of those. And so when we look at hormones here inside, which is point 3, these are endogenous toxins. Now, when we look at hormones, to understand hormones, you really have to look at the total context of hormones. You have to understand, how do we properly evaluate hormones? Blood, urine, saliva, what's the best tool there? So perspective. Then what's the hormone balance? Because hormones, just like I talked about with gut flora, it's about balance of hormones. These are just signaling. Then it's about looking at hormone receptors. And again, looking at, beyond just estrogen receptor alpha, there's beta, progesterone receptors. All of these different hormones have different receptors, and that impacts it. But recognize that hormone receptors are just talking about what's called classical genomic signaling of hormones. There is a absolutely different alternative pathway called non-genomic hormonal signaling that is without the concept and context of hormone receptors. So when we talk about knowing hormone receptors, that's the classic, but there's estrogen can basically stimulate cancer without those receptors. Okay, that's what the literature shows. Beyond that, there is hormone genomics. We have to understand that. Hormone epigenomics, hormone transcriptomics, proteomics, metabolomics, which we'll touch on in just a second, but then also immunomodulomics, outside influence of hormones. And so you can see the context of hormones within this environment that is the body and its ability to produce toxins or eliminate toxins is quite complex. That old cliche of women are just an estrogen fueled hot flash and men are just a testosterone fueled erection is just silly and devoid of any evidence. But that's the way people look at it. There was an old marketing term about 10 years ago where they said, know your number, as if hormones were simply defined by a number. I mean, that is oversimplification and really a devoid of evidence statement, but yet that's what dominates so much of marketing in medicine today. No science. Again, lead with the science, Let's explain it, but lead with the science. Let's not just conflate it with marketing, junk. But so when we look at this context of hormones, we have to look at them. So for example, let's take estrogens. Your body is going to shift in how it metabolizes estrogens based on its environment. Diet can do that. Again, I talked about broccoli as it relates to microRNA influencing estrogen metabolism. There are healthy estrogen metabolite pathways, more or less, what are called the 2-hydroxy pathways. You will metabolize estrogens in a healthy way, tends to be anti-carcinogenic, loose binding to the estrogen receptors, and more anti-inflammatory, more easily turned off, versus there is a very pro-carcinogenic pathway of estrogen metabolism, primarily what's called the 4-hydroxy pathways. And so you get 2-hydroxy metabolites, estrone, estradiol, and then 4-hydroxy estrone, estradiol. And so this balance of these two different pathways, the 4-hydroxy metabolites of the estrogens will actually promote a more carcinogenic effect almost than the parent compound itself. So take estradiol, that's the estrogen we think about. That's the dominant, most potent estrogen premenopausally. It falls postmenopausally, and estrone dominates postmenopausally. But premenopausally, estradiol, very potent, very potent. But when it gets metabolized to a 4-hydroxy estradiol metabolite, it binds to estrogen receptors much, much more tighter. And actually, it's very hard to break that binding. And that causes significantly more DNA damage, and the ability to repair that DNA damage is compromised simply through estrogen metabolism. But what if we can shift from that 4-hydroxy to 2-hydroxy? You actually can. How? Through diet, through inflammation. So this is not just something that's set, you can actually influence it. Set is genomics. Influencing it is through epigenomics. And your greatest way to impact that is through what you eat. It's through what you eat. So diet here even affects estrogen. Looking at progesterone, same way. The concept that low progesterone is associated with an ability to target cancer, especially breast cancer, is in part true, but in part not. So the concept used to be that low progesterone is a classic pathway forward for breast cancer. But if you give progesterone, it's a way to counter it. Now, part of that's true, but the question is, what is the body going to do with that progesterone when you give it? Might that low progesterone be an adaptation to the environment within the body? And thus, when you give progesterone into that disrupted environment, the body's going to do wrong things with it. And that's an important point here, because we have to recognize that there is just a level, but then we have to recognize that the body may do wrong things with what we give it, and that's just disrupted physiology, biochemistry. So giving progesterone into low progesterone environment doesn't necessarily mean you're going to get all the benefits that originally was theorized would come from progesterone in low progesterone women in breast cancer, because we now recognize through a researcher by the name of Weibe, W-E-I-B-E, that actually when you give progesterone in an environment of an individual as it relates to breast cancer, some of this benefit can be anti-carcinogenic, anti-inflammatory, depending on, guess what? Progesterone metabolism adapting to the environment within the context of the body. But at the same time, there could be some women where giving progesterone will actually promote cancer. Progesterone metabolites, just like estrogen metabolites. There are what are called the 4 alpha pregnanes and the 5 pregnenes. These are different classes of metabolites. The 4 alpha pregnanes are promoting an anti-inflammatory reaction of the body to progesterone. But in contrast, the 5 pregnenes will promote a pro-inflammatory, pro-carcinogenic response to the same progesterone in a different body. But understand this may even coexist within an individual, because we know from things like vitamin C, it can be pro-oxidative and antioxidative in the same body, dictated by the environment. Meaning in cancer, it can be pro-oxidative, and in healthy tissue, healthy cells, it can be antioxidative. Beyond hormones, looking at endogenous toxins, another great example here is neurotransmitters, serotonin and melatonin. 5-hydroxytryptophan gets converted to serotonin, which gets converted to melatonin. Melatonin has tremendous anti-cancer properties, but the environment of the body can influence that metabolism down a different way, what's called endo-3-dioxamine pathway, endolamine 3-dioxygenase pathway. And what that does is that promotes a very inflammatory signaling metabolites influenced by the environment of the body, and that really disrupts the immune system and contributes significantly to the process of cancer. So that's point 3, endogenous toxins. And here I'm giving you examples of hormones, and I'm giving you examples of neurotransmitters, but how hormones are really sometimes endogenous toxins. Now, point 4 is toxicants, which is outside influence. Now, this is important because these influence our body, but what we were just talking about is influence from within, okay? Toxicants are what most kind of politically and media focus on as it relates to environment. It's outside in. What I've been talking mostly about is inside out. But this outside, okay, are things obviously that we mostly look at, which is, what's around us in the air, what's around us in the water, all of these things. But again, recognize what we drink, same process. But the problem there is that politics disrupts that and really clouds the issue. What we want to do is focus on the science. And so let me give you just a few examples of quote unquote environmental toxicants as they contribute to the process of cancer or even metastasis. We look at things like, heavy metals. Most people look at these and they say, well, this is going to cause DNA damage. And that is going back to that classic, theory that there's a one-hit, damage, and that's what causes cancer. And that's no longer true. Now, there can be a big hit, but then there's other multiple hits that play a role there. But environmental toxicants, there are heavy metals, you know them as things like arsenic, lead, mercury. Mad as a hatter, that's where mercury comes from, and then cadmium. Now, cadmium's interesting. It's linked directly to lymphomas. It comes, classically metal welding, but cadmium is estrogenic. So not only can cadmium as a heavy metal cause direct DNA damage and disrupt detoxification, which when people think about heavy metals, they think of those two, but it also can bind to estrogen receptors and stimulate hormone signaling that way. So if you have an estrogen positive breast cancer or an estrogen positive colorectal cancer and your estrogens are low and that your cadmium's high, you're missing a significant contributor to the process of that environment that's favoring that cancer. But beyond just that, it actually promotes inflammation. And it does so through stimulating that same pathway that I mentioned earlier, lipopolysaccharide, through nuclear factor kappa beta, through what are called toll-like 4 receptors. Again, technical issues, but I think it's important to understand we have a good understanding of the steps here, the process of how this flows. It's not just theory, okay? We have a very solid understanding. Now, there's lots of complexities in that, but we know that these heavy metals, beyond DNA damage, beyond the process of detoxification compromise, beyond the process of being hormonal, cadmium here is actually promoting chronic inflammation. That ties back to what I talked about as it relates to diet, that ties back to what I talk about as it relates to gut and gut dysbiosis and the microbiome. So what you can see is how this process is individual but also interrelational. And it's all of these pieces coming together that really, really promote and favor this process of cancer, but also help us to heal the body. Another environmental toxicants are things like, when we look at environmental toxins, we think about, glyphosates. These are always in the news. These are chemicals and toxins that we see around in the environment, whether it's in pesticides, insecticides, they're all around us, petroleum-based products, etc. It's really hard in the current context of where we live to get away from them. We can limit their exposure, but it's primarily to help detox them through that process. But take one that's very important here, but often missed. That's mycotoxin. Mycotoxin is a toxin that comes from fungi, all around us. Water in the bathroom. Everybody focuses on black mold, rightly so. Black mold is very toxic. But what about mold that's just producing toxins that we inhale? Not only can these damaged DNA disrupt detoxification, they can promote inflammation, but they too can be estrogenic. In fact, mycotoxins are some of the most estrogenic compounds in the environment that exist. So when we look at this context, many of these toxicants are not just outside. They're not just in our home, in our bathroom, in the ceiling, in water-damaged walls, water-damaged maybe carpet, but it's also in our food. So one of the most common mycotoxins is present in improperly contained and stored food that's on the shelf, rice, grains, these kind of things. And it just grows there. And then we eat it, and we expose ourselves to it every day. Again, home and our bodies are the most potentially impact we can have on toxic environments to affect what we expose to in the home and what we're exposed to outside. So the toxicants around us are very impacting to the potential to promote cancer, but also to promote the effects of treatment and the toxicity, but also our ability to heal. And then the last is infections. And again, we can take deeper dives into this, but when you look at infections, the literature is really, it's quite variable in terms of the direct contribution of infections to cancer. But if you look at collectively, viruses, bacteria, parasites, fungi, these four infections together, probably based on the literature, it's estimated 20% of all cancers are caused by these infectious sources. So let's just take a few. Viruses. Well, it's estimated about 15% of all cancers are caused by viruses. Some of these you know very, very well. Hepatitis B, C, D, contributing to liver cancer. HPV, human papillomavirus, contributing to cervical cancer, but also esophageal cancer, laryngeal cancer, colorectal cancer, vaginal cancer, all caused by a virus. Epstein-Barr virus, many of you know this as mono, major contributor to lymphomas, okay? So viruses are significant contributors to actually the cause of cancer. Now let me tie in a recent event. HIV, we know that plays a role in Kaposi sarcoma, but look at SARS-CoV-2, COVID-19. This virus comes, in part of it has an HIV to it, okay? So part of the genetic material of it's there. There's actually research that shows that spike proteins from this virus combined with lipopolysaccharide from the gut, systemic inflammation, those two together increase the systemic inflammatory process by 50%. So when you look at people that are high risk for COVID, they all have the comorbidities of overweight, diabetic, hypertension, okay? These comorbidities in many ways are caused by that systemic inflammation that comes from the gut. So that foundation was set. Then you came in with the spike proteins and you had massive surges of inflammation. So when you look at this concept that viruses, it's not just something in the past that we talk about and answer in a test question, it's something we see every day. These viruses are impacting our potential to develop cancer in the future. Beyond viruses, there's parasites. And in the United States, most look at parasites and they go, oh, we don't see these, and so thus there's no contribution to them. There are estimates in literature that up to 17% of all cancers are caused by parasites. Now, when you look at some of them, they're flukes, liver flukes, blood flukes. These contribute to cholangiocarcinoma, gastric carcinoma, colorectal carcinoma. So these are actual parasites that cause cancer. And so thus we want to recognize them as contributors and we want to treat them to heal the body because that changes the environment. That's just a few. There's also malaria, Plasmodium falciparum. This is one of the most prevalent infections worldwide, and it contributes to the cause of cancer. So parasites are very real. They're all around us, and these contribute to the process of cancer. Now, beyond parasites, there's bacteria, H. pylori. This is a bacteria that is associated with ulcers, but we also know this contributes to gastric cancer. So when you look at infectious contributors to cancer from a causation perspective, viruses, bacteria, parasites, and previously I talked about fungi through mycotoxins, these are all causing or contributing to the environment that favors the process of cancer. And so if you want to effectively treat cancer, if you want to effectively heal people with cancer, you can't just say, well, let's look at the tumor. That is such a misdirected, misguided approach to tumor. Now we need to treatment of cancer. Now we need to target the tumor, but that tumor is developed out of that environment. Okay? Diet, gut, hormones, endogenous toxins, exogenous toxicants, and infections. And if we want to not only get rid of that tumor, but heal the body, a true integrative strategy, we have to look at the causation, because that's going to promote the environment that heals and prevents cancer from coming back. That is a holistic perspective and view of how the environment outside, immediate in the home, and then inside contributes to our ability to develop cancer or actually counter it and heal and promote wellness. I'm Dr. Nathan Good, your medical director here at Brio-Medical in the beautiful Scottsdale, Arizona. If you want to learn more about how we approach cancer from a holistic environmental perspective, I encourage you to go to our website, read information there, check out our videos and YouTube channel, and you'll find all the information you need to begin your journey to healing from cancer.